Hey people.
Hi.
So,
Hey.
so first I'll continue with the introduction which I was probably given on last Thursday. So now we all clear about what is trigger point and how it costs and everything.
Yes.
Yeah. Okay. Good. So I'll forget to tell about the cost. So common cause of trigger point is the main thing is muscle stiffness. That's the main point. The next point is it's because of overuse. How the muscle stiffness will happen because of overuse. The next one is your acute trauma. If any acute trauma happens, the trigger point will arise. And then your poor posture, and then your stress and emotional tension also, which could cause trigger points. It's some kind of chemical thing which you don't want to go inside deep. And then your usual cold, fatigue, migraine, headache, everything will cause everything is the common cause of trigger points. Okay. These are all the main common causes which are caused by the trigger points, or these causes will cause a trigger point. They are in two ways. Okay. So what are the benefits? The main benefit is fast relief when compared to the stretches or cryotherapy, heat therapy. Trigger point therapy will relieve it fast. Okay. Next one is why I liked it very much is because it's a non-invasive procedure. The patient or client don't have to be worried about whether they get a mark in their body, or it'll be very painful because of it's a needle. It has anything, any substance or anything. So that's the main purpose. It's a non-invasive, and then it's a low cost. Just the therapist is needed to do it, and then no side effects like medication. So these are the main. And the last part is a client himself or herself can able to do this release by doing the self foam roller or lacrosse ball with the use of that they can release it. So these are main three benefits for doing trigger point therapy. The first one is the fast relief. The second one is a non-invasive, low cost and no side effect like any kind of medication. The third one is it selfly you can perform by yourself. You don't need any passive support to do it. So these are the benefits. This is the introduction of trigger point therapy. So today the first muscle which we are going to see is trapezius. As we all know, trapezius has three major parts: upper, middle and lower. So first, before going into the muscle release, so everyone should know about it's must to know about muscle origin and insertion. If you can't able to remember that, you have to know about the muscle orientation, like from where to where the muscle runs. So where the muscle origins, a broad area, it's not narrow part, then where the muscle ends. So as I told in the beginning, muscle release, it's perpendicular direction. You're gonna do in a perpendicular direction of the muscle. So if you don't know the muscle orientation or muscle direction, which direction it runs, there is no, you can't perform it in a perpendicular way, right? You know how the muscle, if you want to know about the bicep, it runs from the top to bottom in this direction, so you can do it in perpendicular direction in this way. It glutes, it runs in this direction, the muscle fiber will be in this direction, so you have to do it in a diagonal way. So for each muscle fibers, there's a different orientation. So you should know, at least you should know from where the muscle starts, where the muscle ends, or the muscle orientation, you should picturize it. So when you are seeing the client or who is lying down, when seeing itself, you should know that okay, the muscle runs in this direction, in this part exactly. So I have to perform the muscle release in the perpendicular way. So that's how we can do it. So the main point is you should know about the muscle orientation, from where it starts, where it ends. If you are not sure about the muscle orientation, it's fine. You should know this. So it's the first main point for it. So upper trapezius, middle trapezius, lower trapezius. So first I'll tell about this muscle. This is the most common, very tight muscle in our clients. Easy to get tight because of their posture. That too in IT patients, IT clients, they'll usually have their neck pain or headache, migraine problem, vertigo and all kind of stuff, radiating pain and everything to the shoulder. So this is the main culprit to, if it's not getting attention, in the future it will lead to cervical spondylosis. So it's disc prolapse in the cervical region. So this is the main culprit for it. So we'll start seeing how the trigger point should be performed. The muscle orientation of I'll share you some pictures, or I'll share you some PDF which I have, so you will know how the muscle runs. Face this side. Face the wall. I think everyone is visible. So the trapezius muscle will start over here for the gross idea, and then it runs. Okay. This is where the trapezius muscle is. It's upper trapezius, mid trapezius, and then lower trapezius. So this is the whole orientation of the trapezius muscle. Okay. So in this you can understand the upper trapezius will run in this direction. The middle trapezius will run in this direction. The lower trapezius will run in this direction. So now we got an idea. So we are going to do it in the perpendicular direction. Okay. So the muscle is running in this direction. Okay. Here, we should do in perpendicular direction in this way. First I'm telling it how to do it, then I'll perform and see. So in this direction. So it's in perpendicular way. When it comes to here, it's in this direction. Over here in this direction. Okay, it's a cross idea. This is not how we're going to perform here. It's a different way. So, but to the gross idea which you want to have, this is in the perpendicular direction. The middle trapezius will run in this direction. So your cross fiber friction will be in this direction. Okay. For lower trapezius in perpendicular to diagonal way. Okay. This is the main point which you want to note it. So for this upper or trapezius release, the client should be lying face down. Tell them to suppose a forehead down. Okay. You should be either on this side or this. While doing on a physio bed, it's easy. While doing it down, you should be moving on then here and there. Okay. So for this side, we should use left hand because it's the left side. The first thing is you have to. There are two methods of doing it. The first one for upper trapezius, it's pinching and grasping. So we'll pinch and then grasp the muscle and then move it. So you can see he definitely has an upper trapezius tightness, so that's why I called him. So just grasp and release. So the movement will be like this. You're just grasping, pulling it out and releasing it. So it's like a ball will be moving inside. This is the main trigger point where the upper trapezius is there. It's present over there. Definitely present for everyone. Okay, this is the main trigger one spot. This is one method of releasing to the upper trapezius. The second method is with your thumb. You can just pinch and hold. It's called ischemic compression. Okay. For this, you should be going on near the client's head. Use the right thumb and then find a trigger point spot and then hold it. So this is where the common trigger points present in the upper trapezius muscle, or this area, exactly this spot in front, this spot at the back. Okay, this is where it's present. This is for upper trapezius. When it comes to middle trapezius, it's between your medial border of the scapula and then spine. Medial border of the scapula and then spine. It's where the middle trapezius trigger point will be present. So how the orientation of the middle trapezius will be running in a horizontal direction. So this is where the middle trapezius trigger point, common trigger point will be present. And then next is your lower trapezius. It will be running and attaching over this part exactly. Okay. So it's in this direction, right? We should do it in perpendicular way. You can use thumb if you're comfortable with, or you can use elbow if you are most comfortable. For everyone, elbow will be comfortable, but while progressing in the practice, will be very comfortable with the thumb. Okay. So in the perpendicular direction. As I told, it's 20 to 30 cross-member frictions per muscle per area. So these are the most common trigger points which will be present in the upper, middle, and lower trapezius. For some people, they have a trigger over here also. It's a common thing. It will be running in the longitudinal direction. So you have to do it in a perpendicular way. So the side to side. But while doing it here, you have to be very careful because it's a main spinal cord area, which starts over there. So the pressure should be very, very mild, and then just release it, but just move the muscle. That's it. You can easily palpate the muscle over here. You can easily move it. So these are the main trigger points for upper, middle, and lower trapezius. I'll just tell you once again. So the first upper trapezius trigger point will present in the mid part of your shoulder and the neck. You can exactly tell mid part of the shoulder and the neck. So that's where the muscle bulk is there. Usually trigger point will present at the muscle bulk. Wherever the muscle bulk is, it will present over there. Not present over the tendon or any other near the bone. It present exactly at the bulk of the muscle. So this is the exact spot. And then for mid trap, over here, between the medial bottle of the scapula and then spine of the spine. Okay, yeah. This is the middle trapezius. For lower trapezius, over this area. So these are the main trigger points for trapezius muscle. The most common cause for this posture is the main problem. If the client complains of this pain, it's mainly because of poor posture, because of their work, because of their any sports activities, because of that only. Yeah, that's all about upper trapezius muscle. That is for today. Thank you.
Can you please repeat the muscle architecture again?
Will you